Good morning. This is Steve Stites, Chief Medical Officer here at the University of Kansas Health System. Delighted to be back with you on this potentially rainy Wednesday morning, broadcasting live from the Dolph Simons Family Studio. On my right, of course, is the ever faithful and outstanding Dr. Dana Hawkinson, our Medical Director of Infection Control, or just Doc Hawk. And we also have two really special guests this morning. One, Anil Garmarkar. You've heard from Anil along this whole COVID journey, and he's here to talk more about his story and his struggles with COVID-19 and some of the sequelae, some of the complications from COVID-19 that he's had to endure, as well as Dr. Leslie Spikes. Leslie is one of our outstanding pulmonologists. She's helping run our post-COVID clinic, and she's been one of Anil's physicians. So that'll be a really interesting conversation. We've got some really good things going on around that. But first, Hawkeye, how are our numbers today?
Yeah, I mean, I think the numbers are better, going in the right direction compared to yesterday when we had 15 acute patients. We have 11 acute inpatients with 4 in the ICU, but 3 on the ventilator, so 75% on the ventilator. Very sick. And then 10 in that recovery period, so 21 total patients, which is still a little bit better than it was.
Yeah, and the Kansas City numbers went down a little bit yesterday on their count. And then just to say, at one point we had 250 total patients, 125 positives, so we're nowhere near that. But we know that it's still out in the community. We see lots of information coming from other countries. We see what's going on in India. We saw what's going on in Michigan and other places. We know that COVID is still a threat, and the way out of threat is follow the rules of infection control and get your vaccine.
Vaccination, yeah.
Yeah, big deal. Let's see if there are reporter questions out there this morning.
Good morning. Cody Holyoke with Channel 9.
Hi, Cody.
Hi. On the heels of the CDC announcement with their new recommendations, I'm getting a lot of questions. Obviously, they said you could take your masks off outdoors if you're fully vaccinated. But I'm getting a couple of viewers wondering, well, how come they're not saying take them off indoors? And I'm curious your thoughts on that.
Yeah, I think the CDC, by its very nature, tends to be conservative in this, and so they took the thing that's probably the easiest and safest to say about outdoors, Hawk.
Yeah.
Indoors, a little dicier, perhaps.
Yeah.
I know that in my family, in our pod, to be fair, we've all been vaccinated, so we don't wear masks. But even prior to that, we didn't wear masks. We said, okay, this is the risk we're willing to accept. We're in a pod. We're gonna, and we're all pretty darn responsible. And anytime we went out, then we would have a mask on. But I think that is a good question. What should we look at inside now, Hawk?
Yeah, I mean, I think inside, I think it still is much more dangerous and risky than doing anything outdoors. So, you're still going to be looking at who's vaccinated. You really can't tell if they're not part of your family or your pod. You really can't tell who's vaccinated. So that's a dangerous thing for sure. A little bit more risky doing things inside. Just like you said, the CDC does move at a conservative pace because they are really involved with the public health of the whole public of the United States of America. So, they're trying to do the thing that is best, baby steps, but trying to keep the most people protected as possible.
Yeah, I think that's right. And so I think the recommendation I would give people, if everybody's vaccinated and you're inside, I think that's one statement. Yeah. I think it's a different statement if you're going to be around others who are sick. Look, here's the problem. It's now estimated that 90 to 98% of infections for COVID-19 are developed inside, not from outside activity. Yeah. So we know that being outside is clearly safer. We also know if you're in a crowded area outside and you're close to each other and you're spending a little bit more time in each other's space, then you can still transmit COVID-19. Remember that if you're vaccinated, you can still give somebody else COVID-19. The risks go down significantly, but they are still true.
Yeah.
So I think what you have to ask yourself is, if I'm going to have other people at my house indoors, for example, are they all vaccinated? And secondly, do the people who I'm going to be around have contacts with those who are immunocompromised? Today, Anil's on our program. And I had to ask him, Anil, have you been vaccinated? Because I know that Anil had a lot of complications after COVID-19. We don't want to expose him to more. Now, we're in a better situation. We're 6 feet apart. We have a negative airflow in the room so that all our respiratory particles go up instead of out and around us. And so that makes it safer for Anil. But we want to make sure it's safe for him. And I think if you're going to have people over to your house and you're inside, you got to know kind of who's in their bubble, and you got to know how safe it's going to be. And you do the best you can. But I do think that indoors is a little bit more at risk. So that makes me a little nervous
Yeah.
when I hear people say, I want to open up all indoor dining, for example, at
Yeah.
restaurants, and we're going to go back to having a packed house. Makes me a little more nervous because I
Yeah.
know that the majority of Americans are still not vaccinated.
Yeah, that's right. And we know that there was that recent study from MIT. That was one line in that whole article that got taken for a headline, which is not true about the whole article. About 6 feet is not any better than, or 60 feet is not any better than 6 feet. That wasn't the point of the article. That wasn't the truth of the article. The authors themselves say, don't take it for that headline itself. That was a series of equations with a lot of variables in it in a specific area. But the point of that was it was an indoor area. And so really what you need to also consider is the ventilation, the amount of people in there, the amount of vaccinated people as well plays into that part. But we do have, the CDC does have a fairly easy readable PDF, which shows just kind of what you can do and just looking down at your activities and should you take precautions, i.e. mask or no mask if you're vaccinated or unvaccinated. So, that is available, just like you said. But again, I think doing things indoors is a little bit more risky than doing things outdoors. And if you do go to other public spaces, you just don't really know who is vaccinated. You don't know who has the disease. Either they are symptomatic or asymptomatic, because we know a large proportion can be spread by asymptomatic people as well.
Other questions?
Yep, just one more.
Please.
I'm just curious, when we talk about vaccine hesitancy a lot, but are you seeing any more interest in your vaccination clinics that you're holding, or is it steadily kind of going down?
Yeah, I'd say we don't have as many arms. We don't have as many people trying to crowd the line or to get the vaccine that we do have. We're still vaccinating folks every day, but the pace has definitely slowed. I think it's slowed throughout Kansas and Missouri, and I think what we're seeing is there's still people trying to get vaccinated, which is great news. And I think that what we're going to see is that this is the pace we're going to be at for a while. And we clearly have more vaccine right now than we have arms. And that's an unfortunate thing, because if we can change that equation, we can get more to herd immunity. We can get back to normal much more rapidly. And vaccination is safe. It's not going to, there's no mind control involved. There's not funny particles that are going to run around and destroy your body. They're not going to jump from one person to another. I mean, vaccination is really safe. And, Hawkeye, you and I got our vaccines as soon as we could. We did it right here on the program to help everybody understand this is something that's really safe. Other questions?
Fox KC had a question today. They write, Michigan and other states are reporting an increase in COVID hospitalizations for teens and young adults, specifically with the B117 variant. What are the ages of the people hospitalized at KU? And are we seeing a similar trend in the metro? What advice would you give to young people, both vaccinated and unvaccinated?
Well, Hawkeye, fortunately, our team was able to give us a rundown of all our patients. So I'm just going to go through it, and when this is a little different for us, so we're just going to tell you exactly what we have. So we have a 20-year-old female here whose test, she was hospitalized for another reason, and her admission screen was positive for COVID-19. They're asymptomatic. A 21-year-old female, also asymptomatic, whose admission screen was positive. A 23-year-old female who is symptomatic and positive, hospitalized then for COVID-19, no vaccination. And by the way, none of these first three people I've just mentioned have been vaccinated. The fourth patient is a 37-year-old female who's asymptomatic, hospitalized for a different reason from their admission screen. When I say admission screen, it means that we screen everybody on admission. And so if you test positive, we know that because we treat that, we have to give you different infection control precautions. That person has also been has not been vaccinated. So again, out of those first four, please note there is a 23-year-old who's symptomatic and hospitalized. None of them have been vaccinated. Number 5, a 38-year-old female, also asymptomatic and positive, was found on an admission screen. Again, that means that we checked you on admission, no vaccination. Then there's a 46-year-old female who is a symptomatic transfer from an outside hospital, again, for COVID-19, no vaccination. Then there's a 52-year-old male who's also symptomatic, no vaccination documented. Then there is a 60-year-old male, asymptomatic positive, admission screen, no vaccination. There is a 63-year-old female who is symptomatic and positive and received their second dose of Pfizer on the 13th of April with a positive diagnosis on April 18th. after being around other COVID-positive family members. Again, remember, the risk reduction is 95% after you've been vaccinated, so you can still be vaccinated, especially if you're if you got your second dose on the 13th. You really don't get a full immunity until 2 weeks after the second dose. And if you're immunocompromised at all, if you come into this with a history of organ transplant, or if you've been on Remicade or other drugs, you may not have the same response to vaccination as other people, because those medications suppress your immune system. I don't know the rest of the story on that person about that. There's a 64-year-old female who is a persistently positive patient who's immunocompromised, asymptomatic, but no vaccination documented.
What is persistently
I'll
positive?
get there. Let me get there. Persistently positive, which means that they're continuing to be positive in their COVID-19 shedding. That is, that we can still find it in their on their nasal PCR. What we don't know, and what I don't know from this information, and we have to be careful how much we can reveal about any patient. What we're not saying here is that person necessarily hospitalized for that, or are they hospitalized for another part of their being immunocompromised? We also have a 71-year-old female who is a symptomatic positive patient hospitalized here for COVID-19, no vaccine documented. So out of the 11 patients, one person has been vaccinated. The others have not been vaccinated. And Hawkeye, that in of itself presents a risk.
Yeah, I think there's two big points here. Number one, the asymptomatic people that were just kind of out in the community, but have come here, and now because they are admitted for a different reason, on the admission screen that's positive. So we understand, again, that a lot of asymptomatic transmission happens. Now, if all those people are out in the community transmitting and spreading the disease, that makes it more difficult to control the spread of the disease. The other big point is the oldest patient that you mentioned was 71 years old. So we know that the highest proportion of deaths occur in those over 65 and plus of those over 80. We don't have any of those patients in the hospital right now, either asymptomatic or symptomatic. I think that's a testament to the vaccination.
Yeah, and I think that just tells you the nursing home that vaccinations have been incredibly helpful to patients, and getting people vaccinated makes all the difference in keeping you safe. And in fact, our data now is right smack in line with what we would expect out of the Pfizer vaccines.
Several times you mentioned that there was no test documented. Do you want to just explain what you mean by that?
No vaccine.
I mean,
No
no vaccine.
documented.
Yeah.
They haven't been. Those are patients who haven't been vaccinated to the best of our knowledge. So
Yeah, okay. It just wasn't in their chart or whatever. Yeah, I think that's all we have right now.
All right.
Oh, they said, what is your advice? For vaccinated and
right?
Get
Isn't that the
vaccinated,
thing?
right.
That's right. Don't we say live long
Get
and prosper?
vaccinated. Please get vaccinated. You know, especially in that younger age group, because we know the younger people do tend to be out into those social situations more. Younger females probably have a higher probability of being pregnant or trying to get pregnant. We know that if you are pregnant and you get COVID, your risk of going to the hospital is more. Your risk of preterm birth is larger. We know that the OB-GYN societies do recommend that if you are in those age groups, and especially it started with the healthcare workers, if you are in those groups that are offered the vaccine and you are pregnant, please go ahead and get the vaccine.
We've heard it from our cancer doctors, our bone marrow transplant doctors, our organ transplant doctors, our heart failure doctors. Every one of them has said, go get vaccinated.
Yeah.
There is no question about its safety, really is, and there's really no question around efficacy. There's a lot of stuff out there on the internet that just isn't true. But we are a living testament, and our health system and all hospitals around the country are a living testament to the effectiveness of vaccination.
Yeah.
Remember, we've talked before about we know infection control works because our employees didn't get sick, even when we had 250 COVID positive patients from being in the hospital because they wear masks. We know that the number of people who are out from our organization because they have COVID-19 has dropped like a rock. I mean, it's down to 1 or 2, and it's all the ones who aren't getting vaccinated are the ones who get sick. We rarely see an employee get sick who's been vaccinated now.
And there was a question about the variants, too. We don't really have good details about the variants. We don't do regular testing or whole genome sequencing for variants, but we had Lee Norman on yesterday, and some of the CDC available data that's available. You know, for the UK variant, it's approximately about 50% of the isolates in the state. The other big proportion of variant is the California variant, which is about 10% from the latest data. So it is around that. But again, a majority of the single isolates or variants is that UK variant in Kansas.
And so about 50% of all testing in Kansas is showing one of the variants, and the other 50% is still the wild type that we first came up with.
Or other types of variants, because we know that there are other different variants out there as well.
Yep. So, it's all out there. Unfortunately, Anil, you were one of the victims of COVID-19. So remind us a little bit. First of all, welcome back to the program, and thanks for being with us. A, how are you doing? And B, remind us, for part of our audience who may not have heard your story originally, remind us about how this all started for you.
It's kind of surreal to be here today because 2 years and 2 days before we flew in, so it's much nicer to walk in than come in on a helicopter.
Yeah.
But I caught it while I was working. I was on a truck. And, it was it came on pretty quick. I mean, it was breathing problems and it felt like pneumonia. And in the hospital locally, we crashed pretty quickly. Mm-hmm. And they didn't have the options we have now as far as treatment. So it was, fairly within a week, they had told us that that my last option was to come on a ventilator and come to KU. I think they were pretty clear that it was, the only option left. I heard later from my doctor at home that I'd monitored things. She reminded me last month. She was like, you should feel grateful you're still here, because there were days that, I guess today, a year ago, my oxygen level was in the 60s.
Wow.
And my heart was failing, and my liver was having issues, and my kidney was attacked. And I think today would be the day my wife got a call from palliative care, and they were asking her how far they wanted to go to rescue me, to what condition I would be okay in coming back. And it was still, questionable. So, I mean, I was on a bed, but she was definitely struggling. So we remember these few weeks, coming to KU. But we celebrate leaving on May 7th. To be perfectly honest, that's the days we look at. We got to come back a few more times than we'd like. Mm-hmm. Yeah. We came back in an ambulance toward the end of May because my airway was closing. Mm-hmm. And then for about 2.5 months, we struggled with breathing and doing high-dose steroids. And I think the last time I was at my local hospital, they actually recommended I not come back because they were just keeping me alive a day longer to figure out what was wrong. And we'd gotten used to a cycle of high-dose steroids, and it was every other day, every third day. And the last time my airway really closed all the way was toward the end of July. I think it was July. And they recommended we come back. That was in Wichita. They recommended we come back to KU, and we were here for 10 days, I think, again. And Dr. Kraft had to do an awake trach surgery, and they rescued us a few times in the ICU. Since then, we've had a few surgeries. I think two surgeries, another procedure to attempt to open things up and fix things, and we still have about every 2 or 3 weeks there's an inflammation flare up, and end up back on steroids and antibiotics and the whole deal. And they the last time I was here, about a month ago, I was with my surgeon here, and she told us that we'd really exercised every conservative option to repair my throat that's left. And she had recommended that we look into a second opinion, and so we're going to do that in May. And it's kind of, I don't know if we're going to try and just deal with the situation as it is, or take a chance at improving it. I mean, I'm not. It's a little. The surgery is somewhat questionable. I mean, I know we're still. We go out May 11th to get our diagnosis, and then we're going to table the decision and just celebrate being alive for a little while and take the kids out and do something good.
I think you deserve that celebration and probably a lot more than that. And again, thanks for being with us. So this has been a hard year. Now, after you got the COVID-19 vaccine, did you feel any different?
Unfortunately, I had a pretty strong immune response, I guess. And I was I got it as a fluke because they had an extra vaccine, so I didn't get time to prepare for it. So we were 6 days after I had 5 teeth pulled. So I also had a couple dry sockets.
You've had a bumpy year, just to say.
It was actually, we had a weird benefit from it because I was on, the painkillers for the dry socket. But when I had the high fever and the vomiting and all the stuff from the vaccine, I was able to cut out the painkillers. And I knew when the immune response was done because I could feel the dry socket again.
Yeah, right.
Okay, well, there was another thing we could chalk up to the vaccine that's good, maybe less bad. So you face some more questions down the road. What advice do you have for our listeners today or those with us that are watching our program?
It's kind of, like I said, it's been difficult and it's been kind of surreal. And, it had some moments, and one of them especially, some of the times when the inflammation starts, it gets really bloody and the mucus is whatever, I'm scrubbing stuff out. But I was looking at my wife and we just, and it was something that we hadn't really said to each other. But there was going to be a cost, for everything that happened. It would be foolish and unreal for me to say that, our lifespan hasn't shortened. And going forward, we need to be very intentional with how we use the time that's left. I'm not saying I'm going to die tomorrow, but, it's not going to be 90 anymore. You can't go through all this and completely be attacked and not think there's going to be a little bit less time. So, looking forward, if I was possibly putting myself in that position, would I want to look back and say, I took a chance at not having 10 more years with my grandkids to get a vaccine, or for, any other. I mean, it's a good time to work on your health. And, would I want to give up 10 years to get a large order of fries every day, or whatever that vice is, because when you're at the end, you're not going to look back. And I was close enough to it enough times to say that, was it worth it to lose that time? And so I would make the best decision possible. If I'm going to gamble, I like the odds on the vaccine a whole lot better than COVID.
Yeah, I think you bring up a good point, a somber point for sure. There's good published data now, I think JAMA Open Network, that showed that people 6 months after illness have an increased risk of excess mortality or continuing to be ill and having to go back to the hospital, just like you're talking about.
They also talked about what percentage of people have this long haul syndrome, and it's not a small percentage.
No. 30%, up to 50% in some of the studies, but generally around 30%, and it affects everything. But even just excess mortality is huge in that 6 months after.
And when you look at that data, it's not just old people anymore.
No.
There's a lot of young people in that, both excess mortality category and in the long haul clinic. So that's tough. So speaking of our long haul clinic, Dr. Spikes is one of our outstanding pulmonologists here at KU, and she has really helped develop the whole long haul clinic. Talk to us a little bit about what you're seeing in your long haul practice. How's it going? Do you have a lot of folks? Because it feels like you've had to recruit more people to help you.
Yes, that is true. Good morning, everyone. Thanks for having me back. Yes, our multidisciplinary post-acute COVID clinic has certainly grown by each week. There was just one pulmonologist each week adding more clinics just probably a month or two ago. And now we have 3 pulmonologists. And I'm just talking about our division. I know our other specialties that are very involved as well in our post-COVID clinic, such as cardiology, our internal medicine, our family medicine doctors, our rehab medicine doctors have all, rearranged schedules and are really trying to make this work and make room for these patients. But what you said just a little bit ago about the percentage of patients that have this long haul symptoms is really disturbing, 30, potentially 50%. And it's not just the patients that had the severe disease and were in the hospital. I just had a post-COVID clinic yesterday, and I saw 8 new patients, and 5 of those were under the age of 30. And like I said, initially I had a pretty mild case, and now we're just having a really hard time, 3, 4, 5, 6 months later, getting back to their normal activities as far as exercising and just getting back to work or school. So it is just another reason to get vaccinated so you don't get this. You may not get really sick with it at first, but you never know how long these symptoms are going to last.
Yeah, I think that's just a brutal story, right? I'm not so sick, and wait, yet now 2 months later, I'm still sick. What are kind of some of the symptoms you're seeing in the still sick category when they come back?
The majority of them have persistent shortness of breath with just kind of what we would think of minimal exertion, maybe climbing up half a flight of stairs, or maybe they're trying to get back to their exercise routine and they can't, run a block when they used to be able to run 5 miles. There's a lot of persistent chest kind of discomfort and pain, and a lot of fatigue, just a lot muscle fatigue, and overwhelming, still needing to take naps during the day, not feeling rested when they get up. I would say those are probably the most common symptoms that we're seeing.
And what's the outlook for folks like that? Are you seeing recovery, or how long does this last? What goes on?
It's varied, and I don't, again, the patients that got sick, we just know about this about a year, for just a year. So we are learning more and more about this. I think some patients, although it's taking time, as in months, are getting better. It's just a very slow process. We've heard some patients that get vaccinated with these post-acute symptoms actually feel better after they get vaccinated. I'm not sure we can explain that totally yet, but again, another reason to get a vaccination, even if you've had COVID. I think overall, that a longer term outlook is really unknown at this time, but I think everyone is hopeful that with time and some treatment, hopefully most will get back to normal. So that's the hope.
Hawkeye, I know you've been involved with this a little too.
Mm-hmm. Yeah, we definitely have a lot of specialists involved to help with this. I think that point that you brought up about those anecdotal stories about the vaccine and maybe reducing some of those long haul symptoms. Have you seen any of that anecdotally in your practice, either with pulmonary symptoms or other types of symptoms?
Yes, I have seen some cases of that. I have.
Yeah, it is interesting, but it's just also, your story and the story of these young people coming in sick, I don't think we talk about that enough. We talk about don't get COVID-19, the risk of death, but really this risk of long haul syndrome, this is really bad. If 30 to 50% of patients, regardless of age, regardless of how sick you were, come back and say, I'm really sick, that's tough. That's really tough. What's their mood like? What's their mental outlook? And do they think, gosh, I wish I'd been vaccinated, or I wish I wore a mask? And what are you hearing from their stories?
A lot of them, definitely. I don't delve too much into how did you get this or anything like that. Most of them, because unfortunately, a lot of the objective testing that we do, such as chest X-rays or pulmonary function testing or echocardiograms, are coming back normal in these patients. Not all the time, but a significant amount. And so that discourages them too, because they know something's wrong. They know they don't feel right. And yet we're telling them, well, your tests are normal. So a lot of them are very discouraged. And I think a lot of reassurance by their doctors and our post-COVID pulmonary or multidisciplinary clinic has really helped their outlook in general, because they're very grateful that we have put this out there and are listening to them and trying to help as best we can.
Yeah, well, good work. We're so glad you're out there doing that. Well, Jill, let's turn to our community. Let's see what questions are out there.
Sure. Cindy wants to know, how do you treat them?
How do you treat them? Okay, what are you doing?
Chest X-rays and the tests are Good.
That's a very good question. You know, I can only speak from the pulmonary side of things. You know, if the objective testing is all normal, such as their pulmonary function test, or chest X-ray, or CT scan, it's very hard to know what to do. So I'm encouraging all of them to slowly, you know, get back to physical activity. We've referred some for pulmonary rehabilitation or physical therapy, just so that there's monitoring of that type of activity. Occasionally, I've had patients, even if they've had normal pulmonary function tests, we've tried types of inhalers or steroids, and that has sometimes helped. It's a lot easier to treat someone if you have a test that you can say, oh, okay, this is what's wrong, and this is how we can treat it. But you know, a lot of these patients were really kind of grasping for different things.
Is there a neuromuscular component to this? Meaning, is there some muscular weakness that you're seeing either in the diaphragm or respiratory, the muscles of breathing?
I think that that's really hard to capture unless we do, you know, the complicated cardiopulmonary exercise test, which can kind of point that direction. But that is one of the main reasons we got our rehab and physical medicine colleagues involved in this, is because there does seem to be some type of muscular disability, whether it's respiratory or just in general. Muscle fatigue is definitely, I think, a part of this.
Yeah, so much. Okay.
All right. Pamela wants to know from Anil. She wants to know more about how your symptoms come on. Is it every 2 or 3 days when you're having, is it regular or is it intermittent? How do you feel day to day?
I've got days where things seem better, and then we haven't really isolated why. It'll just, the inflammation will kick up, is the best way I can explain it, and the airway closes up a little bit. Breathing gets harder. I'll have to switch to a speaker valve for directly breathing out of my trach. A lot of times the mucus, we can tell from the discharge on the mucus, it'll start changing colors, and we know, you know, the infection's coming. Like I said, my primary care doctor, she's got to the point that she has me keep steroids and antibiotics with me at home, and just call her when things are starting to get worse. And I still see her regularly, but it's just because I have a tendency to wait too long sometimes to go in. And the last time she got mad and gave me shots and almost hospitalized me.
So, you know, this is a story of chronic illness, though. People who don't have chronic illness may not appreciate this, but when you have a chronic illness, you're always walking a bit of a thin edge. And little things that won't affect somebody who has normal health at baseline, right? They have normal health at baseline. You get a cold, that's okay. You're going to get better. It's going to take 5 to 10 days. You're going to be all right. When you have another type of a chronic illness like what you have, you're always walking that thin edge. You're never feeling great, but some days you feel better than others. And little things, the amount of pollen in the wind, the air temperature, the change in the barometer, a little bit of an infection, not enough sleep, maybe not even eating the right things, a little bit more heartburn, all those things can tip your scale just a little. And because there's so many variables, it's hard for any individual patient to control all of them. That's part of the struggle of chronic illness. And that's, by the way, why you want to live long and prosper and get vaccinated so you don't have to put up with it.
Yeah.
Does that describe you pretty well?
Yeah, that's pretty well. I mean, because of the airway injury too, though, I have trouble with exertion. So even like carrying boxes, stairs, you know, little things that were pretty normal. I know we're going to Disney World, and my wife's threatening me that if I overdo it, she's going to follow me around with a wheelchair.
Oh, boy, your wife is a pretty tough lady.
Yeah, I try not to cross her.
That's probably a good idea.
It's hard for us sometimes.
Yeah.
Yeah, she's here today too, and we were visiting.
But I think that's an important point too, is, you know, and Dr. Spikes had mentioned that, and these are otherwise healthy people in the workforce who have been going out, and now they can't do that. And it's hard because you can't go to work and you can't get that income to support you and your family and things. So that's one more reason to help try and prevent the long haul COVID as much as you possibly can. And again, doing all the masking and the public health guidance, but also the vaccine is such an important part of that.
Yeah, it comes back to what we've always said. There is a way to prevent this story from happening to you, right? And you can see it in the testimony of the patients we read at the very beginning of the list. If you get vaccinated, you can be safe.
Yeah.
If you're not vaccinated, you're just not safe.
And Anil didn't have that opportunity.
He didn't
And
back
he was
then.
driving back in his truck. Extremely ill and barely able to
trying to
breathe
get back
and doing
home.
that. Yeah.
Yeah.
I remember that story. I remember
it's
right here
a
on this
crazy
program,
story.
you were telling that story. So.
As I was saying, I was visiting with Anil's wife, and this next question is a question that I actually kind of sort of asked her. Rita says that in her family, they're fully vaccinated. They believe the science, but they have other family members who don't, and they believe the conspiracy theories. And she wants to know, what can you say to them? Is there anything you can say to them that might change their minds? And how does it make you feel?
I think for us, we just had to set boundaries, and this is where we are. This is what keeps us safe. And if you're going to participate in that, you're more than welcome. If not, for our sake, you're going to have to keep our distance. One of our daughters has a blood circulation disease that leaves her prone for blood clots. So my wife, like you said, she's been very tough on taking precautions. And even when, with COVID going through our community and all over the place, I can say that, her and the girls, probably 3 of the only people I know that have never had a COVID test. Thank God, I prayed for a few things before the ventilator. One of them was that they didn't get sick, that I didn't give it to them, and the other was that they would be okay if I didn't come back. That if I got a second chance, I would do better. Unfortunately, when I was that close to God, I didn't ask him to heal me all the way. But, without the reminder, I might have gone about my life and thought everything was okay. So, maybe it's there for a reason. But,
You are still the best person on this program.
Right.
Because this is the story of
Yeah.
COVID-19. This is the story of the tragedy as it unfolds across our country and our society. And it is preventable. And it is a great question. What do you tell somebody who believes in conspiracies as opposed to the science and thinks that the deaths aren't real or that it's all a hoax? What do you say to someone who chooses to believe in false idols? I think that's hard.
Yeah, I think just exactly what you said. I think it's difficult to reason with somebody who uses, in their line of thinking, in their rationale, flawed, false, blatantly wrong rationale and reasons to then develop their opinion of what is going on. So it's very difficult to get past that. Again, seeking out truth. But if someone is using, again, we know there's a lot of misinformation out there. If someone is using that misinformation or blatantly false line of thinking or facts to develop or support their line of thinking, it's very hard to get past that. It's very hard for them unless they do realize, what the truth is. The conspiracies, they're all out there for various topics, but it's very difficult to get past that for sure.
Leslie, what do you say to folks? Dr. Spikes.
I just try and reinforce how many that, I've gotten it. My nurses, our staff has gotten it. Millions, tens of millions of people have, hundreds of millions of people almost at this point around the world have gotten these vaccines, and there really does not seem to be anything significantly unsafe about it. But it is very hard when there is a certain mindset to try and change those minds.
It's kind of what we said early on in the program. People want to just make it up. So let's say I'm going to go to the bank and I'm going to tell them I'm just going to make up how much money I have so they can give me a house. And it's funny, that just doesn't work very well. And so why is it we allow people to just make stuff up and then we turn around and believe it? Come on. We got to do better than that. And when we don't do better, we see what's going on around the country when people refuse to get vaccinated or they don't want to believe the science.
Jean and Stacy are both worried about Johnson County perhaps ending the mask mandate, and they wonder what you think about that. Is that going to cause a spike? What can they do?
Okay, so I'll take the first swing at that. I'm going to turn to Hawk, and we'll both take a swing at this. So, I do think there's an appropriate time to stop the mask mandate inside and outside. I think we already talked with them. The CDC's always saying, hey, look, if you've got small gatherings, you're not around a lot of people outside, you're not packed in for long periods of time, you can take your masks off outside, especially if you're vaccinated. Okay. The inside one's harder. Because the data around that is not as clear that there is a safe path forward unless you have a lot of people vaccinated. Now, I'm not in the business world per se, and so I don't understand all the pressures the restaurants and the theaters and other groups have. And so I'm going to stay in a healthcare lane and not necessarily in a social economic lane, because that's a different question there. And I think the politicians have to balance your health risk against the economic risk, against the what the elected, the body politic is saying to them from the standpoint of who elected them. So all those things are variables that are hard to account for. What I think I can say, though, from a pure healthcare lane, is that I don't think the evidence is clear enough right now that it is safe to go indoors without a mask. I don't think the evidence is clear enough right now that it is safe to eliminate capacity limits so that anybody can go inside or restaurants can go back to full capacity. That is a different statement than saying this is what an elected official should do. But I can say and I think comfortably from a healthcare standpoint, that I don't think there is evidence to say that it is safe right now to do those things, Hawkeye.
Yeah. No, I completely agree with you. There's nothing much else to say after that.
Okay, and Elizabeth wants to know, can immune-compromised people find out how effective the vaccine has been for them? We have a couple of people that are asking that. And also, should they get the vaccine? Is it safe?
Well, absolutely you should get the vaccine. There is no question about that, because even if you get 30, 40, 50% protection, you've just lowered your risk of getting it. And so there's clear data that it is better to get it than not get it. Now, how much do you have to get and how often do you actually convert to having a high seropositive level? I think, Hawkeye, that really depends upon the underlying disease and the med you're on.
Yeah, exactly. I think let's start with, we had our expert on, Dr. McGurk, who deals with patients with absolutely no immune system, either because of the cancer itself or because of the bone marrow transplant. He said, absolutely, we recommend it. We still give it to all of our patients. So get it, because the chance of benefit is much greater, much greater than any chance of harm from that. So go ahead and get it. We don't know, there's not a real good test about identifying that immune response. But also we do have some evidence from solid organ transplant patients like kidney, lung, heart, liver. They have certainly a reduced immune response to that antibody test that they're looking at. There really is no commercial antibody test for looking at necessarily neutralizing activity after the vaccination. There's really no commercial test for T-cell immunity either after vaccination. So we really wouldn't recommend getting a test of immunity after vaccination. But the answer to that second question is yes, definitely go get that vaccine.
Dr. Spikes, anything you want to add to that?
No, I think I think definitely you've covered that. I recommend the vaccine to all of my patients, and some of them are on medications that suppress their immune system as well. I also take care of pulmonary hypertension patients that are on some pretty complicated regimens, and all of them I highly recommend getting the vaccine. Absolutely get the vaccine.
In these immune-compromised patients, they've been getting vaccines forever, too, especially if you're with solid organ transplant or bone marrow transplant. That is part of your pre- and post-transplant regimen, is to get those vaccines, and that is like the pneumonia vaccines, influenza. Now that we have a non-live virus or the subunit shingles vaccine, getting those vaccines because we know the potential benefit is much greater, much outweighs any potential harms. So.
Last question today is from Ashley, and she wants to know, what are you finding as the cause of long haulers with severe brain fog?
Oh, great question.
Great, yeah.
Dr. Spikes, any insight about that?
No, there's definitely theories, and their disruption potentially of what we call the blood-brain barrier. There's no evidence that the virus itself that we can tell affects the neurons or the brain cells directly long-term or in the short term. But all of that is being very much explored. The NIH and the Congress have recognized this very potential serious problem of long haul post-acute COVID, and they are getting ready to announce funding here in just a couple of days for very intensive research into why a brain fog is happening, why are these patients feeling short of breath when we can't find anything wrong on the testing. So there will be a lot of new research and new answers as we go forward.
Yeah, so important. Hey, we're going to turn to our folks here today about final thoughts. But first, tomorrow, the Journal of the American Medical Association, also known as JAMA, is releasing research about the impact of COVID-19 on cancer screenings. Research partly done by our own chair of radiation oncology, Dr. Ronald Chen. Dr. Chen will be on the program to share the findings, which frankly are not really good and are going to require a large public health effort to overcome a major deficit in cancer screenings. We said before, we are seeing cancer presenting later and later because people didn't go get their screening done and they didn't go get help. We're going to explore that topic more tomorrow. Dr. Weil will be here for me as I have to go to my doctor tomorrow morning. Oh my gosh. So final thoughts, Dr. Spikes.
Final thoughts, get your vaccine. And if you are experiencing these long haul post-COVID symptoms that we're talking about, please have your doctor, if you choose, get referred to our multidisciplinary post-COVID clinic. We have so many great specialists and involved, and our entire health system is so supportive of this. So if you need anything, just get a referral in.
All right, thank you. And thanks for being on the program. Thanks for being a big part of that long haul clinic. That is so appreciated, Dr. Spikes. Anil Gallmucker. And I don't ever know if I say your name quite correctly. Am I close?
Pretty close, yeah.
Okay, good, we'll take that.
I had a moment of brain fog there. Like for real. No, I would second that. Definitely get the vaccine. I mean, we're definitely, in a moment, for our family, this week is definitely solemn. I'll say it again. It's so much better to walk in than fly in. And, just really, to the people that are having symptoms, my experience here is that, the staff and my medical team and everyone I've interacted with has been spectacular, and being at the front, I think as my surgeon said, she's like, you were the first one to come through. And she said there would be people to follow. She's gone above and beyond, in my opinion, to try and find a solution and find what was wrong. The outcome wasn't optimal. It wasn't what everyone hoped for. But, we've definitely made progress, and we've gotten to a place that I'm okay with. And, for everyone that's at KU, if anyone's watching, if anyone's there from the many floors I've visited, thank you to everyone, everyone from the food to dietitian department up to the top doctors was just amazing.
Thank you for being on our program again, and thanks for telling your story, because I think as we try to chip away at this, we need you, and we need all that have had this to tell the story of how bad it is, to help convince those who can still get vaccinated to do that. Hawkeye, final thoughts?
Yeah, I'm just going to yield to our guest to my left here and continue to second what he said and encourage everybody to get the vaccine so we don't end up with these significant complications and these long-term complications, things that are easily preventable with the vaccines that we have. So,
in this age of connection and information, I sometimes wonder how we can be so disconnected while we are connected. We are disconnected too often from the truth, and it feels like there's this stone of falsehood, this stone of discontent with science or with government or with each other. How do we chip away at that? And I think it's people like Anil who come to the program, and I think every time he speaks, man, it just chips away at it. We need all of you to help us in that journey. We need you to help us chip away at the stone of falsity, which keeps us from really being connected again. We can get fully reconnected. We can get in fully into the presence of each other and do it safely. But how do we do that? Do we do that by trying to spread lies and conspiracy about things that aren't really true? Or do we do it by trying to take the safe route and doing the thing that we know protects each other and protects ourselves? You've heard Anil's story. You don't want to have to tell that story because it's your own. You want to be able to tell that story to help others become vaccinated so that we can come together again and truly be connected. We'll be back tomorrow.